everybody, today's we are shooting a video on treating hip, and like the previous video we talk about ankles, knees, shoulder, wrists, elbows and other stuff. So today we'll show you how we actually also treat the hip, and I think it's one of the most neglected area in the body that people don't realize. We use our hip every single day, or we don't use them as much, but all the muscle came in your leg, it actually came from the hip. So it's extremely important to make sure you take care of your hip for the health of your back and your knees and everything else. So here we go. And like on previous treatment, we start with the cupping first. And then you can see I already have some mark on my hip and my thigh. So you can see we focus a lot on the IT band and the quad and then the hip flexor area. And then you see after 10 minutes of cupping, to help reduce the lactic acid and break up the adhesion between muscle and fascia. Now we do acupunctures, because cupping is helpful, but it's not deep enough, it's very more superficial. So now we're gonna do the acupunctures, where we increase circulation and energy in the area. And with acupuncture, you can see Dr. Moon insert the needle, same pressure, but some area are more tender than other, because it depends on the energy level there, or also the inflammations. The more inflammation you have, the more sensitive that area is, you might feel it more. But even if it's you feel the pricking needle, that shouldn't last for more than a few seconds. And sometimes when you get a spasm area, you can see the muscle twisting as well. And you don't have to have any injury or any conditions to get acupuncture or cupping. It's just like same thing with maintenance care. You see a lot of athletes now, they get cupping and acupunctures anyway, because all it is increase the energy in the local area, so it help you recuperate faster, help you heal faster. All right, so you guys seen the cupping, the acupuncture. So cupping basically help reduce lactic acid buildup by break up the adhesion between muscle and fascia. It open your pore, it pour more toxin in the muscle. Acupuncture have increased energy level in some area. Do same thing, help remove lactic acid, promote healing. But those are only address the muscle. Now is the chiropractic adjustment, where we're gonna adjust the joint, have the joint have more mobilization so that more fluid can get in and out of the hip joint. And also Dr. Moon gonna help me with some stretching as well, and more physical therapy stuff to help elongate my muscle, help me learn to fire the muscle better. So here we go. See, and as you can see, the spine and the hip are connected, so that's why he also work on my spine and my SI joint. Yep, where he's poking this piriformis muscle is right the muscle either above or where the sciatic nerve usually come out from. And as you can see, one of my hip might be tighter than the other. It's very common because we always favor one side of the other. There, now he's stretching my hip flexor and my quad. Same thing, you can see this side is more flexible. Yep, and the hamstring tightness is highly affect the low back pain. And prolonged sitting definitely cause tight hamstrings. And same thing, my left hamstring is tighter than my right. This one we stretch the piriformis muscle and open up the hip joint. All right, so I want to show you guys something quickly, because some of you might ask me, what is the normal range of motion of the hip? If you cross your leg like this, you should be able to level your knee. So the hip and the knee should be almost level. So if your knee is up here, you know you have really tight hip. So both sides, same thing up here. When you cross your leg like this, you should be able to touch the table. So you're even like this. So for those of you, most people I notice is when you have a tight hip, you go up and they're like this. And some of them can't even bring your knee up here. So yeah, if you cannot bring your leg up like that, you definitely need to work on the hip flexors, because the way the hip joint design is a ball and socket. So if you don't have full range of motion, for example, you don't get all the way to here, you never use this area of the joint, that area will slowly deteriorating. Like I said earlier, you don't use it, you lose it. So make sure, most of the hip, we only use this motion, right? So make sure you open the side as well. So you the sides, stretch out. So make sure you have full range of motion of the hip. And if you don't, you have to better work at it, because otherwise, over time, most of our work actually strengthen our quad this way, but we rarely work on this side. and deficiency in attention will definitely lead to weakness in the cartilage and weaken in the joint. So some of the hip might be too much work here, but not enough on the side. So definitely make sure any range of motion on any joint you have, make sure they have full range of motion. Otherwise, just sooner or later, they're gonna break. All right, so that wraps up some of the basic treatment of the hip that we perform here. So hopefully that will give you guys some understanding of the importance of the hip and how cupping, acupuncture, and chiropractic adjustment can help promote the hip health as well as maintain hip joint or even treating hip issues. So if you have any questions, any confusions about what we talk about, do not hesitate to put in the comments, and I'll try to answer them as soon as I can. And if you like what you see, please subscribe. And if you have any topic you'd like us to work on, write it down in our comments, and we'll accommodate your request as soon as we can. Thank you for viewing our video, and hope to see you again next time.